Hello, everyone. I'm Arya, your host, and welcome to today's FB Live session. Well, if you are Indian origin living in US and your parents are visiting from India, you do not need to worry about their medical needs in US. eGlobalDoctors has your back. They have different packages for you starting from $199 that provide access to 300 plus doctors from USA and India. With 30 plus specialties, prescription will be provided and they get back to you within 1 to 3 days of time. Family members can participate live via video physician consultation from any part of the world. Video consultation is about 30 minutes and in-app messaging with doctor after consultation is available. Visit www.eglobaldoctors.com and register yourself now. In today's FB Live session, we will be exploring and providing more information about the topic, which is very concerning right now, especially in Africa and everywhere in the news, that is the monkeypox. So we have with us today Dr. Katyal from St. Louis, US. He has been practicing in US since 1996. So with 30 years of experience, he is board certified in internal medicine, critical care, neurocritical care, and sleep medicine. Welcome to the FB Live, Doctor. How are you doing today?
I'm doing good, Arya. Thanks for having me back again.
Yes. So let's begin with this topic. What is monkeypox? It's everywhere in the news we are listening to, and what does that name? What is monkeypox exactly?
So it is a zoonotic infection. By that I mean the infection that gets transmitted from animals to humans. So it's a virus, and the name monkeypox actually is a misnomer. It was first discovered in monkeys in 1958. But actually the reservoir for this virus is African rodents, but it still carries the name monkeypox.
Oh, okay. Okay. So is it similar to the COVID virus?
So it's different than COVID virus in the sense that, COVID is an RNA virus, highly transmissible. Monkeypox comes in a different category. It's a DNA virus. And it comes in a genus which includes smallpox, vaccinia, which is the virus used to make the vaccine against smallpox, monkeypox, and cowpox. So in that genus, these are the four that come. So it's definitely different than your COVID virus, which is an RNA virus.
Okay. So you mentioned about smallpox and cowpox. So does this fall in the same category, or is there anything different?
No, it is related. So it comes in the same genus. As I said, it falls in the same category as the smallpox, which we know was eradicated from the world in 1980.
Okay, right. Yeah. So how worried should we be about, because we already went through this pandemic and COVID-19 for 2 years almost, and now we are hearing about monkeypox. Everyone is definitely worried about if any pandemic is about to come. So should we really be worried about it? What is your
So as I mentioned, Arya, it was first discovered in monkeys in 1958, and the first human infection was reported in 1970 from Democratic Republic of Congo. So this virus is endemic in Central and Western Africa. But in the past, it has been restricted to those parts of the world. And what we are seeing currently is its extension beyond the African continent, and we are seeing it in basically all continents, in Europe, in North, South America, in Asia. So that's the cause for concern. As I speak today, we have had over 1,000 documented cases of monkeypox worldwide. And in United States, as of June the 7th, we had about 35 confirmed cases of monkeypox. So it is certainly a cause for worry and concern. And I will also point out that in Africa itself, where it is endemic, in the Central and Western Africa, there are two sort of variants or clades of this monkeypox. The one that is seen in West Africa carries a mortality of about 1%. The one that is in Central Africa carries a case fatality rate of about 11 to 14%. Luckily, whatever they have looked at from Europe from the early sequencing seems to be the clade from Western Africa, which again carries a mortality or case fatality rate of only about 1 to 4%. So that's the somewhat silver lining in the early cases that we have seen.
Oh God. Okay. So what are the basic symptoms of monkeypox? Then how can it be diagnosed? How does someone know he or she has it?
So usually people who develop this, they go through a prodrome that is, they may have fever, chills, and then they break out into this rash, which usually starts from the face and then, spreads towards the arms and towards the sole. They have, headache, myalgias, and the most important thing is their lymph nodes, like in the neck, in the axilla, and the groin, they get enlarged. So when you see the rash, that is very, particular about smallpox and monkeypox. But what they're also observing is that the cases that they have noticed in Europe, the rash is not appearing on the face first, but sort of in the genital areas, etc. So that's a little bit atypical, and some of these cases didn't have the prodromal features of having fever and chills, and just broke out into the rash. And then the rash that they notice goes through various phases, starts as a macule, then becomes a raised area called papule, then becomes a vesicle, then becomes a pustule, then it scabs. So it transitioned to different stages. And when you have a clinical presentation, and then you have tests done, at least in the United States, it's a two-step process. The states first do the testing from wherever the lesion is, if it's on the face, from your throat, wherever, they get a sample, and the states then label this as a presumptive monkeypox. They label it as an orthopox virus. That's a big genus I mentioned. And then that sample has to go to the CDC, which is the only place, in Atlanta that confirms the diagnosis of, monkeypox. But in today's day and age, if a state makes the diagnosis of orthopox virus, then it's safe to presume that it is monkeypox. So based on the clinical presentation and the lab findings that usually are taken from these lesions or, the scabs, sometimes from the throat, it has also been, PCR positive from the blood and the urine too, but the viremia is very transient. So usually it's from these typical rash that you see, these lesions, that you get the sample and confirm it through a PCR test.
Okay. Okay. So prominently the rash is one of the main symptoms, and it shouldn't be necessary that it starts from the face and then comes down.
Exactly. And one other thing you asked about, what's the difference between this and smallpox? As I mentioned, smallpox has been eradicated, but the main difference is in monkeypox, you have the lymph nodes that's, underneath your, chin, in the axilla, in the groin, these lymph nodes that become enlarged, that differentiates, monkeypox from smallpox. Again, we don't see smallpox in this day and age.
Okay. So while we are talking and giving information about monkeypox, the first question that strikes in someone's mind who is watching us would be, is there a vaccine available against monkeypox?
So there is a vaccine available. There is advisory committee on immunization practice in 2007 approved a vaccine called, ACAM 2000. It was a second generation vaccine. It had a lot of side effects. So if you see people, in the past who say they have been immunized against smallpox, they'll see that sort of scar on their forearm or thigh. And that's the old vaccine, but it had a lot of side effects. It has, replication competent virus, meaning the virus can replicate in the body and you can transmit the virus. But in 2019, there was a second vaccine, which is called, a modified vaccine, Ankara, that is in United States marketed as Genios, that is available here in United States. It's a third generation vaccine, and the virus that is there cannot replicate. So it is a much safer vaccine, and it is approved both for smallpox as well as monkeypox. And you can use it both for pre-exposure, that is before exposure, if you're at high risk, or post-exposure, after you've been exposed, you have come in close contact. So you can get this vaccine like within 4 days, then it will, the symptoms will not show up. But if you give it up to 14 days after exposure, then the symptoms may not be as bad. But I will also point out this vaccine is not available for sort of commercial widespread use. To put things in perspective, this is produced by a Danish company, and the United States has a stockpile of about 36,000 doses of this vaccine currently.
Great, great. So, but during COVID, we faced a lot of issues with the availability. So if it comes to that and the vaccine isn't available, so can someone take the smallpox vaccine and still be safe about it?
So the vaccine that I mentioned, the ACAM 2000 and the Jynneos vaccine, the modified variable Ankara vaccine, are approved for both, smallpox as well as monkeypox. So the one that's used for smallpox, that is available in millions, which has unfortunately some side effects, which is used for smallpox, is about 85% effective for monkeypox. And that we have a stockpile of, hundreds of millions of that vaccine. But the newer third generation vaccine, certainly the stockpile is much limited.
Got it. Okay, got it. So we talked about the symptoms like the rashes and the headache. So how long do these symptoms last?
So the incubation period of the virus is about like 5 to 21 days, and the symptoms may last 2 to 4 weeks. So as long as you have these lesions on your skin, till they scab off and a new skin forms over those lesions, you can still spread the infection. So one other thing I'd like to point out is, how does this spread? How do you get the virus? So there are 3 different ways of getting it. One would be, if you get in contact, as I mentioned initially, it's a zoonotic infection. So if you come in contact with animals, that are infected with monkeypox, if there's a bite, if there's a scratch, if you come in contact with any fluids. So that is one way of contacting it. The second way of contacting it is human to human. So if you're in close contact with the secretions that are there from these, rash, then you can transmit it to the second person. You can also transmit it through, respiratory route, just like COVID-19, but the droplets are much bigger. So that is also one mode of transmission. To put things in perspective, for initial COVID-19 strain, we said there are 2 individuals who are not wearing a mask, and if you're in close proximity within 6 feet for about 15 minutes, you can contact the virus. But for monkeypox, you have to be in close proximity for at least 3 hours before you can contact the virus. So it's not as transmissible. So through the droplets, through close contact with skin lesions, and the third most important is through fomites. If you're sleeping and you're using a bedding and your lesions come in contact with that, and then someone else then sleeps on the same bedding, then you can also contact it. So those are the 3 main modes of transmission of monkeypox.
Okay, got it. So about the severity, can it be fatal?
So again, as I said, the good thing is all the cases. So to put things in perspective, we have had no deaths from monkeypox outside of Africa. There have been 66 deaths in Africa, but all the other cases in Europe, North America, South America, Asia, there have been no deaths. As I mentioned, the kind of variant that we are seeing worldwide is the Western African one, which has a case fatality rate of 1 to 4%, as opposed to the Central African kind, which has a higher mortality rate. But to answer your question, it can be a fatal disease, and also it depends on severity. So people who are immunocompromised, in children below 8 years, those individuals, those would be at risk for, more serious infection. You can have, the hemorrhagic, lesions on your skin. People can develop encephalitis, that is, inflammation of the covering around the brain, which can then lead to hospitalization. And while we're on that, as I mentioned, there's a vaccine, but there's also antiviral medications that can be used for monkeypox.
Okay. So you mentioned children below 8 years would be at a greater risk. So who else should be watching out for it? Like, who are the greater risk people to catch monkeypox?
So anyone, you know, who is immunocompromised, who has other comorbid conditions, whose immune system is not too strong, obviously they would be at greater risk. In general, like other viral illnesses, for the most part, this stays, you know, you don't have to get hospitalized. It runs through the course, the rash, and so forth, as I mentioned, through different stages. And it may take up to 2 to 4 weeks of isolation, and you may not require hospitalization.
Okay. So even if you have taken the booster dose for the COVID, we still have to take precautions to not catch the monkeypox.
Exactly.
Right. Okay. Coming to the last question, what would you suggest the precautions we should be taking to avoid this?
So the most important thing with this virus is, again, as I said, avoid contact with people who have come from areas that it's endemic, like, you know, Central Africa, Western Africa. If you know in a particular area there is monkeypox, avoid contact with animals, because again, as I said, animals can spread it. As far as precautions are concerned in general, if you are in close proximity to someone, if you're hospitalized, we recommend, you know, a negative pressure room. And the people who come and see those individuals, they need to wear, you know, the N95 mask. It can spread through your mucous membranes, so you need to have goggles, obviously gloves. So contact, airborne, aerosol precautions in those who are sick enough to be admitted. But otherwise, you know, again, as I mentioned, the mode of transmission is either even through kissing, sexual contact. It's not a sexually transmitted disease, but you know, close contact like that of a person. Again, in the prodromal phase, you may not have the rash, but certainly you can get it. And then again, as I said, the animals. And if you are infected, then the fomites, the bedding, etc. Luckily, whatever detergents you use to clean the stuff kills the monkeypox. So that's the good news.
Okay, right. Yeah, so I think we have learned quite a lot about monkeypox today, the basics, what precautions we need to take, how the symptoms look like, how it can be diagnosed. So thank you so much, Dr. Katyal, for taking out your time and sharing this information, valuable information with us and everybody watching here. Thank you so much.
Thank you so much, Anya.
Thank you.